do you sometimes feel a strange sore on your skin that doesn't heal quickly? Or maybe a sudden high fever after handling animals or animal products? These could be signs of a rare but serious disease called anthrax. While anthrax isn't common, it's important to know about it, especially if you work with animals, live in rural areas, or handle raw animal hides. Think of it like a hidden danger that can surprise you if you're not aware. Have you ever touched raw sheepskin or worked on a farm? If yes, this might be more relevant to you than you think. So what causes anthrax? It is caused by a bacterium called Bacillus anthracis. Imagine tiny, invisible bad bugs that can survive for years in soil, animal fur, or even dead animal remains. These bacteria are like sleeper agents. They stay quiet until they find a way into your body. For example, if a farmer breathes in dust from contaminated animal wool, or a butcher gets a small cut while handling infected meat, the bacteria can enter and start causing trouble. It is not spread from person to person, though, so no need to worry if someone near you has it. The main culprits: dirty animal products and unsafe handling practices. Now, how do you know if it's anthrax and not just the flu? That depends on how the bacteria got in. There are 3 main types. First, skin cutaneous anthrax. You get a small sore that quickly turns into a painless black sore, kind of like a scab that won't go away. Example: a goat herder notices a strange black mark on his arm after a scratch. Second, inhalation anthrax. You breathe it in, and at first it feels like a cold, but then sudden high fever, chest pain, and trouble breathing happen fast. Third, gastrointestinal anthrax. You eat infected meat and end up with severe stomach pain, vomiting, and bloody diarrhea. Scary, yes, but catching it early helps a lot. Doctors don't guess, they check. If anthrax is suspected, they take samples, skin swabs, blood, or mucus from lungs. These go to a lab to find the bacteria. Think of it like detective work. They look for the fingerprint of the germ. Treatment must start fast. Antibiotics like ciprofloxacin or doxycycline are used, just like how you take medicine for an infection, but stronger and longer. For severe cases, patients might need hospital care and extra support like oxygen. The key: don't wait. If you have a strange sore and work with animals, speak to a doctor right away. Early action saves lives. Good news: anthrax can be prevented. First, avoid handling dead or sick animals, especially in areas where anthrax is known. Use gloves and masks if you work with animal products. Second, there's a vaccine, but it's not for everyone. It's mainly for high-risk workers like vets, lab staff, or soldiers. Think of it like a shield for those most likely to meet the enemy. Also, cooking meat well kills the bacteria, so always eat properly cooked food, never raw or undercooked meat from unknown sources. Simple habits, big protection. Scientists are always working to improve how we fight anthrax. Recently, new faster tests have been developed to detect the bacteria in hours, not days. Some researchers are creating better vaccines that are safer and work faster. Also, there's progress in using antibody treatments, special medicine that helps your body fight the bacteria quickly, like giving your immune system a power-up. In one cool example, a new nasal spray vaccine is being tested on animals. It could one day protect people just by a quick spray. So while anthrax is dangerous, science is staying one step ahead.